Hey there, let's dive into the evolution of anal fistula management based on Dr. Addissouky's 2025 review. It's a super stubborn, complex condition, but it's surprisingly rare, affecting only 1 to 2 in 10,000 people globally. Traditional surgery hits an 85% success rate for simple cases, but complex ones, they risk severe bowel incontinence. Today, we use a sophisticated map, combining high-resolution MRI and 3D ultrasound to really pinpoint the active inflammation. Treatment is all about complexity. Grades 1 and 2 need traditional surgery, while higher grades demand advanced precision tech. A real game changer is muscle-sparing tech like lift. It safely ties off straight tracts, achieving up to 80% success. Another option? Advancement flaps. We literally move healthy tissue to cover the internal opening. You need excellent blood supply, though. Then there's FiLaC. This precision tech uses just 10 to 15 watts of laser energy to safely seal the tract. VAFT is a video-assisted method giving a live internal view. But heads up, it requires elite skill and expensive gear. But lasers have limits. Success drops hard, from 75% down to 50% when dealing with complex, branched tracts. For really stubborn cases, stem cells act like biological magic. They literally regenerate tissue without ever cutting the muscle. It's a pricey rescue treatment, sure, but it hits an incredible 50 to 70% success rate for hopeless cases. So, moving past that outdated one-size-fits-all surgical era, what exactly does the future hold for treating this? The future is personalized medicine. AI algorithms will literally predict the perfect mix of surgery and biologicals just for you. Always consult a specialist first. But man, it really leaves us wondering, will AI completely replace the surgeon's scalpel someday?
Join us in our channel, Addissouky, to understand, to be safe.